Introduction. The retina is the interior lining at the back of the eye, which is made of light-sensitive cells called rods and cones. It is involved in the perception of light and vision. Retinal detachment is a medical emergency where the retina retracts from its normal position and disconnects from blood vessels supplying it with oxygen and nourishment. If left unchecked, this could lead to permanent vision loss in the affected eye. Types of retinal detachment. There are 3 types of retinal detachment. Rhegmatogenous retinal detachment is the most common type that occurs with aging. Here, the vitreous fluid, a gel-like material which fills the eye, undergoes consistency changes, causing it to shrink and pull away from the retina. This may cause a tear or hole in the retina. The vitreous fluid then passes through the hole and accumulates underneath the retina, causing the retina to detach from the underlying layer of blood vessels. Exudative retinal detachment can be caused by an eye injury, inflammatory disorder, tumor, or an age-related condition called macular degeneration. In this type of detachment, the vitreous fluid accumulates beneath the retina, causing detachment, but there are no tears or holes in the retina. Tractional retinal detachment occurs due to growth of scar tissue on the retinal surface. It is common in people with poorly controlled diabetes. Causes. Retinal detachment may be associated with previous eye injury or surgery, age-related macular degeneration, severe myopia or nearsightedness, tumors, inflammatory disorders, diabetes. Signs and symptoms. Although retinal detachment is painless, there are certain signs and symptoms that indicate its onset. These include blurred vision, sudden appearance of numerous floaters or tiny drifting specks in your field of vision, flashes of light in the eyes called photopsia, reduced peripheral vision, shadowing of your visual field. Diagnosis. Retinal detachment can be diagnosed through the following. A retinal examination is performed with an instrument with special lenses and a bright light to obtain a detailed view of structures inside the eye. Ultrasound imaging may be recommended if the view is obstructed due to bleeding in your eye. Your doctor may ask you to return within a few weeks of your initial examination to confirm the diagnosis of a retinal detachment and check the progress of the disease. Treatment. Treatment depends on the extent of the retinal damage and detachment. For retinal tears that haven't yet progressed to detachment, your eye surgeon may suggest any of the following outpatient procedures to prevent detachment and preserve your vision. Photocoagulation or laser surgery. In this procedure, a laser beam is directed into the eye through the pupil. The laser makes burns around the retinal tear, forming scar tissue that helps seal the retina to the underlying tissue. Cryopexy or freezing. For this procedure, you will be given a local anesthetic to numb your eye, after which a freezing probe is applied to the outer surface of the eye directly over the tear. The freezing generates scar tissue that helps secure the retina to the eye wall. After your procedure, you will be advised to avoid activities such as running for a couple of weeks to avoid vigorous shaking of the eye. Retinal detachment. If your retina has detached, your doctor will recommend surgery to repair it. The type of surgery will depend on the severity of the detachment. Pneumatic retinopexy. This procedure involves injecting air or gas into the center of your eye where the vitreous is present to form a bubble which presses the detached retina against its underlying layer. Any damage to the retina can be treated with cryopexy. Scleral buckling. This procedure involves indenting the surface of your eye. Your surgeon stitches a piece of silicone to the sclera or outer surface of your eye, overlying the area of retinal detachment. This indents the eye wall, pushing it against the retina and reducing the tension on the retina from the shrinking vitreous. For more extensive detachment, a scleral buckle is created that wraps around the eye, indenting its surface. Vitrectomy. This procedure involves draining and replacing the vitreous fluid in the eye. Your surgeon removes the vitreous along with any tissue that is pulling on the retina. Air, silicone, oil, or gas is then injected into the vitreous space to flatten the retina against its outer layer. The liquid, air, or gas is gradually absorbed, and body fluid refills the vitreous space. A buckling procedure may be combined with vitrectomy to prevent detachment. Summary. Retinal detachment is a condition that requires immediate medical attention. Consult a doctor if you are experiencing any of the above symptoms. With timely intervention and advanced treatment options available, your vision can be saved.